A massive push for change in policing around the country is also coming from members of the Boston City Council. Among those filing measures for change and a closer look at operations is our guest, Councilor At-Large Michelle Wu. Thank you very much for being with us, Councilor.
Great to be with you.
Councilor, looking at the things that you've been working on, one word that comes to my mind right away is that you're seeking, especially with the police department, more transparency. So what should that mean?
That's right. We're in a time when the whole country is having a conversation about how our public safety systems haven't created safety for every community, particularly Black Americans, and how our criminal justice system exacerbates injustices economically and racially. So to center that in Boston and figure out the action steps that we can take to act with urgency and to end systemic racism and oppression, we need to be clear about what the facts are. Let's start from a baseline of shared understanding. So I've asked for information on a number of different categories. One is to understand the ways in which Boston Police is militarized, the equipment and vehicles and tactics and training and how these have been deployed, as well as how we've been spending our resources in this moment. Because for me, and I know for many community activists and for my colleagues, this is not so much a question that is limited to the scope of policing and even public safety, but how we are investing in communities as a whole, and whether we're seeing the right balance between public safety, public health, and community stability and opportunity.
Well, one long-standing pattern, and I don't think it's only about Boston here, is that you have some cases where police actions that involve force are basically absolved as far as criminal acts, but there's a lot of dissatisfaction out there about whether there's something else wrong that should have been taken care of. What about that?
Yes, accountability is key too. It is not just having the right policies on the books, but ensuring that when there's deviations from that, particularly when there are deviations that result in continued harm to communities and communities of color, we need to know that there will be justice served. So in Boston, there are a couple different strands moving forward. One is the call for a civilian review board. This would be an independent body that would review complaints against police officers that either for misconduct or use of force or violence. And Boston has a version of something that's similar to this called the Community Ombudsman Oversight Board, the panel, the co-op. And it doesn't have much teeth. It hasn't been well resourced in recent years. I think a lot of people in the public might not even know about it. So we're supporting the call that community members, particularly from the Black community in Boston, have been issuing for decades now to have an independent civilian review board with subpoena power. There's also a push at the statewide level for what's called POST, Peace Officer Standards and Training. And essentially, it's a licensing and decertification system so that statewide, just like we license businesses to cut hair or provide dental services, police officers don't have any sort of ongoing licensing that they have to fulfill, and therefore no decertification mechanism when there are records that cause question. Massachusetts is only one of 6 states that doesn't have such a licensing and decertification process for police. Minnesota, in fact, is one of the other 6. So that has been proposed at the state level as well.
Of course, in the discussions around the country, there's a lot of thinking about whether we should redefine the mission of police, because certainly there are things that can only be done by police, but there are some other things that are important, controversial too maybe, but maybe they should be done by someone else, or at least in a different way.
Absolutely. And I think that's really what the conversation is about when everyone is talking about funding and where the funding should go. The way that I see it, it's really about defining what our law enforcement should be doing. And in fact, many of the calls that our police officers are asked to take care of are not best suited for someone with a law enforcement background, and in fact, may result in more harm that way. So calls for someone who could be better served by a mental health clinician or a social worker or a community outreach worker or someone with background in substance use. Many cities have taken this model on, and in fact, I'll give you a sneak peek of a policy that we're filing later today that hasn't been announced yet, proposing that Boston's 911 system would in fact be diverted so that there would be a community safety response, and nonviolent crisis emergency calls would be handled by trained, unarmed specialists that have a background in either mental health care or substance use or outreach to residents experiencing homelessness or some other way.
Another area where you're looking for more transparency now is with pandemic relief. We've heard a lot about this relief going to people who really need it, they're going to diverse people, but where are the doubts in your mind right now?
Yes, this is in the same way that the funding conversation on police is about whether we're adequately funding public health. I hold this as part of the same issue, that as militarized as Boston Police are and how much resources we've put as taxpayer dollars to creating that situation, we also need to know how we've been investing in communities of color and in local Boston businesses during this pandemic. So along with my colleagues, Councilor Julia Mejia and Ricardo Arroyo, we've requested by today a list of all the recipients of the 3 cities relief funds, Small Business Relief Funds, the Rental Assistance Fund, and the Boston Resiliency Fund. What are the demographics of the recipients compared to the applicants? What have the outreach mechanisms looked like, including language access? And how many of the new contracts that had to be taken out because of COVID, whether it's to buy masks for city employees or address some other unexpected need, what percentage of those contracts went to so-called MWBEs, minority or women-owned business enterprises? We know Boston has a very low percentage of that citywide for the contracts that the city of Boston puts out with city taxpayer dollars. And sometimes we hear that that's because those are multi-year contracts. It takes a while to change the inertia of the current system. But with less than 1% of those contracts awarded to MWBEs, we have urgency so that every new opportunity that's available should see more commitment and intentionality there. So for the new COVID contracts, we need to see those same numbers.
You mentioned the militarization of police forces. There has been some tolerance to that because of terrorism, but on the other hand, how much of this is about training, management, or even mindset?
Yes, that's very much what I wanted to emphasize in creating a comprehensive list of information that we're requesting, that it's not just about the physical resources, the tanks or weapons that are acquired, although we do have to have the conversation about how the federal government, through a program, often delivers these weapons to communities that do not need them for free or for very low cost because of the military-industrial complex. But aside from that, even in how we interact with residents from the law enforcement side, how we are thinking about the relationship between police and community. If you are coming from a training and a mindset that is militarized, to see residents as enemy combatants or to manage situations in a certain way, that's a very different dynamic than the one that we hope to see, which is based in community trust.
I know a lot of neighborhood Main Street districts have been hit hard by the economic fallout from the pandemic. You were recently plugged into a look at the effects in Chinatown. What was your main takeaway from that?
The economic crisis will last longer than the public health crisis. Businesses are struggling because they have taken every action that government has directed them to take, and it has resulted in tremendous loss and financial hardship. And it's been frustrating from my point of view that at this point in the pandemic, now months in, Massachusetts is still having the conversation in a way that it presents a false choice between making the best public health decision and making supporting the economy growing. It's not a false, it doesn't have to be that choice. If we had more information on, if there was testing and contact tracing, we would know exactly who could open and where and when. If we had more clarity about the predictability of timelines, businesses could have structured their operations a little bit better. So the onus shouldn't be on individual business owners to make the right choice, and it shouldn't be on individual employees to make the right choice. And we continue to see gaps in that way. Even as there are now protocols for, when you're at a workplace, how far apart people have to sit and how many customers you can serve at one time, we're still not guaranteeing the types of protections for most workers that would give them the freedom to stay home if they felt sick or were worried they might have come into contact with someone who had the virus, because they don't have paid sick leave or their days haven't accrued yet. And so you're asking people to make a decision that shouldn't be difficult to make because we haven't provided the public infrastructure to support that.